Everyone. First of all, thank you for joining us on this Bennington Battle Day. I appreciate the fact that you're taking the time to come on for us to update you on COVID testing, both at Marble Valley in Rutland and at Tallahatchie County Correctional Facility in Mississippi. We got a lot of information coming together all at once. We wanted to try to do something at the end of last week, but we didn't quite have it nailed down, and we didn't want to wait any longer this week, so we decided to set up this press briefing today to update all of you. So let me talk about Marble Valley first. Testing dates, well, first of all, we stepped out of our normal rotation of testing a facility a week. So every 6 weeks, we would have been testing a facility. We've stepped out of that rotation because of our concerns about the positive tests that had come back in Rutland, which included the 6 original Mississippi inmates that returned and tested positive on the 29th of July, the 1 other inmate that tested positive, and then our 2 officers that tested positive. And so we stepped out of that rotation and we tested Rutland in that rotation on August 7th. And because of those positive tests, we decided to test the facility again last Friday, the 14th. And we're testing the facility again tomorrow, the 18th, because of the positive tests. So on the 7th of August, there were no new positive tests. There were a total of 160 staff and inmates tested, and there were no positive tests out of that August 7th testing cycle. We tested again last Friday, the 14th, and there were 176 staff and inmates tested, and there were no new positives. So we will be testing that facility again tomorrow. And that's really based upon our contact tracing that we did and concerns that the virus could have got beyond our confined space in our quarantine unit. And so those 6 positive inmates have displayed no symptoms. The other 1 inmate also is asymptomatic. Unfortunately, our 2 officers have been sick. They are not hospitalized, but they have had symptoms as a result of being exposed to the virus. I've spoken to both officers. They are getting better, but they do remain with symptoms. The August 4th was the last time either one of those officers were in the facility, and all the other close contacts to the officers have tested negative. So both of them are quarantined at home right now. We are trying to figure out through contact tracing in the interview process that our partnership with the Vermont Department of Health has in creating an emergency response team that we formed as a result of the outbreak in Northwest in April, are figuring out if and where our protocols broke down in order for our staff to be positive. That's not to blame anybody, it's to try to figure out where they were exposed and to try to figure out how to repair if in fact our protocols broke down. We will be going back after we test Rutland this week. We will be going back to our rotation next week. So every facility, a different facility, is tested every week. I will talk about this again, but I will remind you that Tallahatchie will become the 7th facility. So we will test facilities, 1 facility a week for every 7 weeks, and then start to cycle over for the foreseeable future until we feel that we are beyond the threat to the facilities from the virus. No one knows how long that's going to take. Let me talk a little bit about Tallahatchie. 219 inmates there. As a result of testing last week, we are now at 176 inmates positive. That's a percentage of about 80%. There are, as I speak, a total of 33 negatives. The testing dates that were done were July 31st, August 6th, and August 13th. The numbers are a little confusing because some inmates refused to test the first time, and on the second testing of the negative inmates, some inmates decided to test, other inmates refused. So we have now 33 negative tests waiting for the last testing, which was done last Thursday, to come back. We are anticipating that we could see more positives. Right now, the majority of those inmates are asymptomatic. We are watching 4 inmates. 1 inmate is hospitalized, and we're watching 4 inmates very closely as we are following all the inmates there in daily phone calls with our medical team and our operational teams to keep track of those inmates. We have classified 119 of the 176 inmates as being in recovery. And what we mean by recovery is that we use our guidance from the Vermont Department of Health, symptoms and time. If a positive test individual goes 10 days with no symptoms, we determine them to be in medical recovery. And right now, in Mississippi, 119 inmates are in medical recovery. We are waiting for the August 13 test results to come back. I think it's important to point out that the difference between Vermont and Mississippi in general practice, not just in the facilities, jail facilities, but in the state itself. In Vermont, we test to suppress. It's been a focus of Governor Scott for a period of time. And in Mississippi, they were testing only if individuals were symptomatic. We have talked with CoreCivic about testing moving forward. They are in the process of testing their staff and the remaining inmates from the other states at Mississippi as we speak. We will be getting an update tomorrow on where they are with that testing process. The other point I want to make about Tallahatchie, there was a report last week of an act of violence at the facility involving inmates from another state. I want to reemphasize that death had nothing to do with our inmates and was in a complete different section of the facility and didn't involve any Vermont inmates. To repeat, all our inmates are safe and we're not involved in that act of violence. So with that, those are the updates to Marble Valley and the Tallahatchie, and I want to open it up for questions from the media.
Thank you, Commissioner. Okay, we will go in the order of RSVPs from the press. So first up, we have Lauren from WPTZ. Lauren, are you with us and unable or able to?
Can you hear me?
There you go.
Hi, Lauren. Hi, Lauren.
Hi, how are you?
Good. How are you?
I'm good. My question for you is, how have you guys changed procedures or updated any guidelines for employees and inmates to follow since the outbreak at the beginning of the month?
Are you talking in Mississippi?
Yes.
Yeah. So first of all, as I reported before, I'm in direct contact with the CEO of CoreCivic, and we have an understanding about what our needs are when it comes around the testing piece. Second of all, we sent staff down to Mississippi, and we're in conversations about sending a second team down to put eyes on the operation in Mississippi. We sent that team down, and we also rewrote protocols specifically for Tallahatchie, based upon the protocols we used here around such things as cohorting, contact tracing, the proper use of PPE, and so on. And so we validate that on a daily basis on an operational call with staff on the ground down there. And we validated that when our staff was on the ground. Now, when our staff was on the ground, we did find some concerns about the way protocols were followed. And that caused us to have a conversation with CoreCivic about getting up to snuff on protocol. Does that help, Lauren?
Yes, thank you.
You're welcome.
Thank you, Lauren. Next up, we have Adam from the appeal.
Good afternoon, Adam.
Adam, if you're on the line, can you unmute yourself? Okay, we'll return. Next up, we have Liam from VPR.
Hi, Commissioner.
Good afternoon, Liam. How are you?
I'm all right. Good afternoon yourself. You spoke just in your opening comments about kind of the difference between some of the testing strategies in Vermont and Mississippi. And, it's hard for us to know exactly if Mississippi's approach to the coronavirus pandemic is going to change at all. So I guess I'm just sort of wondering a little bit about the degree of confidence that you have that CoreCivic is going to be able to continue to kind of keep an eye and keep Vermont inmates safe going forward. I mean, you spoke a little bit about protocols changing, but do you have confidence that long term, as we go through this, pandemic, which we have no idea when it's going to end, that they can kind of continue to do their job in this case?
Yeah, Liam, that's a great question. I mean, first of all, I will tell you that I believe that my conversations with the CEO, I think he has a pretty good understanding about my expectations as the commissioner about the care of the inmates there. I will say that my level of confidence is greater now than it was 2 weeks ago. But it's one thing to trust, it's another thing to verify. You can trust, but you got to verify. And we're doing the best we can to verify. And we are demanding and receiving very clear updates on medical reports on every inmate there. And that is not something I think they've been used to. And we're able to get that information. Look, going forward, I think it's just not Mississippi, but it's Vermont too. We have to remind our staff all the time. It's been a long time since March. I mean, it is, I think everyone, just not folks that are overseeing jails, but everyday life, this has been a long haul. And I just had a conversation with staff last week about having to keep our edge. To have the level of concentration and focus that we have to have takes an enormous amount of energy and strength to do that every day. And we have to keep our edge. And what we have to do is stay on Mississippi to keep their edge. Now, as far as the testing goes, they are limited in their ability to get testing done in Mississippi. And so we are working on making sure if we have to provide them with collection kits, and we will have a conversation about potentially seeing how we can assist with the testing. But we have to have them test the same way we test a facility a week in order to understand that the facilities are safe. I hope that answered your question.
Yeah, and just to follow up there, you said you've become more confident,
Yeah.
But is this a situation, I mean, is this sort of like, a 3 strikes they're out situation? I mean, how much more leeway are you willing to give CoreCivic as we kind of continue to see case numbers rise and going forward? I mean, is this sort of like the one chance they get, or I guess I'm just sort of wondering, like, how much rope are you willing to give in this situation?
Well, look, the situation is what it is, and I cannot tell you how disappointing it is to look at a piece of paper in front of me that says 80.4% of the inmates that the Commissioner of Corrections Vermont, that's me, are responsible for are positive. This situation has got to be managed through this situation and then no more. I understand that that facility's in a location that has an enormous amount of community spread. That means you got to double down on your protocols to prevent the community spread for coming into your facility. So I don't want to put it in how much rope I'm going to give them, but I do think that my conversations with the CEO are pretty blunt, and I think we have an understanding about what the expectations are. Again, what is the outcome? If they don't do what we're asking them to do, I'm not in a position to sit here and say that right now. But I will tell you that conversations with our legal counsel and others, you know, we would explore options if, in fact, they didn't live up to what they've agreed to do now. But I have to say, they are doing what we're asking them to do now.
Thank you.
You're welcome, Liam. Good talking to you.
Thank you, Liam. Next up, we have Lisa, Associated Press.
Good afternoon, Lisa.
Lisa, are you on?
Good afternoon. Can you hear me?
Hi, Lisa. I can hear you.
Hi. I have a question about the two correctional officers at Marble Valley.
Yes, Lisa.
When did they test positive, and did they have any interaction with those returning inmates from Mississippi?
They tested positive. Just bear with me 1 minute.
Sure.
I'll give you that date in a minute. Rachel, can you look for that date? Because I don't just.
Yes, they did not test during mass testing of
Right.
either facility. They were identified, as the commissioner will explain in a second, through contact tracing.
Right.
They tested with private healthcare providers. So that's the information we can give on when they tested. We can tell you when they were last working in the facility.
Right. So as a result of the contact tracing from the 7 inmates, the 6 from Mississippi and the 7th from the facility that was quarantined with the 6 inmates from Mississippi, we determined who had contact, and that's how we identified the 2 corrections officers. They were tested outside the mass testing schedule because of the contact tracing information that we developed.
Oh, I see. Okay. All right. And then back to Mississippi. So does CoreCivic have any contractual obligation, though, to do this testing? I mean, it's got to cost them some money, right, to follow our testing guidelines.
Of course, when we signed the contract, I don't think anybody envisioned that we would be in the worst pandemic, viral pandemic, I know in my lifetime, and I'm suspecting I'm probably a little bit older than a lot of the folks on this call. So we would have never put in a contract the expectation of testing as a result of a pandemic outbreak.
But have they, the cost of testing, is that an issue for them, or have they brought that up with
There
you?
is, no, they have not brought it up with me. And I think the reason why they haven't brought it up with me is because I would consider this medical care. And they do have a contractual obligation to provide medical care to our inmates in Mississippi.
Okay, thanks.
You're welcome.
Thank you, Lisa. Next up, we have Liz from the Burlington Free Press.
Good afternoon, Liz.
Good afternoon, Commissioner. Thank you for taking my question.
You're welcome, Liz.
I wanted to know if there was any update on whether DOC has found out if there are vulnerable inmates still in Mississippi, and if there are any plans to be transporting any inmates back to Vermont from Mississippi at this point.
Yes, Liz. So we do know, we do have a list of the inmates that we're most concerned about because of their medical profile. We know who they are. When Dr. Strenio went to Mississippi on behalf of him being our part-time medical director, he did in fact see as many of those patients as he could. We do know who they are. We have had conversations, and this is just not a policy decision, but a medical conversation about bringing back individuals who are high risk. And at this point, Dr. Strenio and our advice is that we should be very cautious about that because they have been exposed to the virus. In many cases, they've been in lockdown, so they have not been active in moving. And the transport people, either by air or by car, could put them at substantial medical risk. And so at this point, that's not on the table for a conversation. Our focus is to get through this, providing the best medical care we can to the folks that have been affected. And then we'll have to have a conversation about that with our medical advisors about if it's medically wise to bring them back here for future medical care.
Thank you. And just to follow up, how many of the 219 inmates over in Mississippi are considered vulnerable? And for what reasons are they considered vulnerable, just in general?
I think the number's in the 20 category, plus or minus. Remember, a lot of the folks that are in our jail system, including Vermont and Mississippi, for a host of reasons, if you looked at CDC guidance, they would be put in a vulnerable category. What we did was look at them from a medical evaluation standpoint. And so it's things like a history of heart disease, diabetes, emphysema. Those are the kind of things. And it's just not, the folks we're looking at are not just one of those. They have multiple chronic care issues that are challenging, that put them on the radar screen for us. And they are getting more scrutiny than the other folks, for example, the 119 that are in recovery with no symptoms. They're a subject, I get two times a day, I get an update on that population.
Thank you. And just one other question. Has there been any update at this point as to, I guess, looking into how this happened, how so many inmates over in Mississippi were exposed to the virus, and like who's accountable for that?
Right. There has been some contact tracing done, but when you have this kind of numbers of an outbreak, it's going to be hard for us to figure that out until all the testing of the facility is done, which they're in the process of doing now. Our best guess, based upon information and conversation from our medical advisors, is community spread. The county where the jail is, as of a week and a half ago, was 10th in the country in community spread, percentage-wise. Mississippi, as we know, is up there as far as community spread. Facilities like jails are only as safe as the community spread around them. And I've said this many times, the reason why we've been as fortunate as we have in Vermont is because of the collective effort of everybody in Vermont to keep community spread down to the people who are willing to wear masks and preventing from community spread. They're playing a role in our jails staying clean.
Thank you very much.
Good talking to you.
Thank you. Okay, next up we have St. Albans Messenger, Michelle.
Hi, Michelle. Michelle, are you there?
Michelle, are you on?
Hello? Hello?
I can hear you,
I'm getting
Michelle.
close to your feet.
Yep.
Good. Good. It was just very strange. My question is about the surrounding hospitals. With that much community spread, how confident are you that we would have, that those hospitals in Mississippi have the capacity to handle some additional Vermont patients should some of those inmates become more seriously ill?
We do a daily, we have Mississippi report back to us. Dr. Strenio keeps track of this. Number one, on capacity in the hospital, capacity in ICU, and the capabilities of the ICU. We've identified the hospitals, I believe it's within 60 miles of the facility, and Dr. Strenio keeps track of that on a daily basis. So we know exactly how many beds are open there, and we have that conversation with the medical team on the ground in Mississippi daily.
And I'm assuming that there are no plans to, at this point, send any more Vermonters to Mississippi for the foreseeable future.
That's correct.
Okay, that does it for me. Thank you.
Thank you, Michelle.
Thank you. Next up, we have Sawyer from VT Digger.
Good afternoon, Sawyer.
Good afternoon. Can you hear me all right?
I can hear you, Sawyer.
Great. So just to kind of follow up off of Liam's question from earlier, I guess what I'm wondering is, you know, with the amount of COVID cases that we've seen in Mississippi, coupled with, you know, this recent act of violence that left one inmate dead, although it's in a different section, I'm wondering what's the next steps in terms of working with CoreCivic? Is this kind of our last contract with them, or are we exploring a different contractor to house inmates going forward?
That's your question,
Yes.
Sawyer, correct? Okay, thank you.
Yeah, the relationship with CoreCivic Corps, sorry.
Yeah, look, you know, I made this clear from the beginning when this outbreak occurred. We have a business relationship with CoreCivic. And in a business relationship, what's important is that it's like any other business relationship, and especially a serious business relationship. You know, you could be a company that has a relationship with a healthcare provider, and you expect certain things from that relationship and that contract. It's the same thing with us. And I made it pretty clear in the beginning that some of that trust, which is important, excuse me, sorry. Some of that trust that should have been there was lost in the beginning. We're slowly building that trust up. Our contract with CoreCivic expires in the fall. We have been for a period of time talking about an extension. The challenge we have is to up and move 219 inmates to another business relationship or bring them back here is very challenging. So as I sit here, I can't tell you exactly where that conversation is going to end up. But we will have to continue a conversation with them as we make long-term plans not to use out-of-state facilities. And again, this has been 20 years of using out-of-state facilities. At the height of it, 500 to 700 people out of state. We're down to 219 now. We need to continue as a department and a state, and policymakers need to stay focused on working to do a better job of providing services in the community so we can keep people in the community and supervise them versus being in jail, so we can continue to reduce the numbers that we put out of state. Where our relationship with CoreCivic goes is hard to tell, but we'll have to make that determination in the next 30 to 40 days.
Thank you.
You're welcome, Sawyer.
Next up, we have Derek from 7 Days.
Hey, Darren, good afternoon.
Hi, Jim. My questions, I think, hope to get at the testing turnaround issues down there. I'm wondering when you learned of these new positive cases when they started rolling in. My sense from your earlier comments was that this stems from the August 6th round of testing. When did you start getting those results?
I'm not sure the exact date, but you are right. It's from the August 6th, testing. Those tests coming back are rather slow. I would say, Rachel, correct me if I'm wrong, somewhere around Thursday of last week, they started rolling in. And confirming those, you know, it sounds simple, but even here in Vermont, we'll get results back and we sit on them while our staff audits the results and matches them up. And we often find, for example, an inmate on a staff list or a staff on an inmate list. We found, you know, people on both lists, on one list positive and another list negative, and you have to chase those down. So I think we started getting them back around Thursday of last week.
And have you gotten any from the August 13th round yet?
No.
Okay. So thank you for those details. I guess my follow-up question then is just how is the, well, I guess two, how is turnaround time for these tests affecting the response down there? And two, why is the number still going up?
First of all, to answer the first part of your question, test results coming back this slowly are very challenging because what we've learned about the virus in Vermont inside the facilities, our quick turnaround gives us, when we do get a positive, gives us a quicker opportunity to do contact tracing. And the sooner we do that, the better we are at identifying the contacts in order to mitigate any more spread. I can only guess, and I'm not a medical expert. Your second part of your question is, I had told the CEO in my first conversation with him that he needed to test every inmate and every staff simply by the pure numbers that we had originally. I think the first number we put out there was 146, correct, Rachel? 146 positive?
Correct. We initially said 147, but that accounted for that
Correct.
one positive case that was already identified. So 146 new positives. That number was confirmed on August 7th, the day after day 7 testing of the negative TCCF inmates was completed.
So here's my point, is that the slow turnaround does not help us contain the virus. So I can only guess, we're not surprised that these numbers have gone up. In fairness to CoreCivic, let me just add this. In fairness to CoreCivic, they can't depend on the Mississippi Health Lab like we do here. And they're sending tests to commercial labs, which are completely overrun. So I can't blame this on CoreCivic. It's testing capacity that's driving this outcome of waiting for results.
Thanks.
You're welcome. Thank you.
Thank you. Dom from WCAX, do you have a question? Dom, are you there? Okay, we'll return. Devin, Fox 44.
Good afternoon, Devin.
Good afternoon, Commissioner Baker. Can everybody hear me?
I can hear you, Devin.
So I heard you mention the potential for a second visit down to Mississippi. What is the timeline for that? And what would sort of the nature of that visit be compared to the first visit that happened? I believe it was last week or 2 weeks ago.
So my vision of that visit would be similar to the last visit. Number one, some type of medical staff that goes down. And again, as I said earlier, a business relationship is built on trust. Trust is one thing, validating is another thing. So we would have hopefully a medical staff person go down to validate what we're being told every day. And we would have one of our protocol subject matter experts go back down and check protocol.
All right, thank you.
And then the third piece, I should have said this. Third piece is have contact with our inmates to gather from them their viewpoint about what you do.
All right, appreciate it. Thank you.
You're welcome.
Okay, that's worked through our list. I'm going to go through and call for those who did not answer the first time around. Do we have Adam from the appeal? Adam? Okay. And then I know we have a few other outlets on the line, Caledonian Record, Vermont Business Magazine, and the Rutland. You have all indicated you don't have any questions. If you have questions, now is the time to ask them. Tim, Patrick. Okay. Does anybody else have any other follow-up questions for the commissioner?
Yeah, this is just Liam from VPR. You mentioned that one inmate was hospitalized and you were keeping an eye on another 4, I believe. Can you speak to the condition of the one inmate that's hospitalized and how the other 4 are doing that you're watching?
Yeah, and Liam, I want to be really, really careful about protecting privacy rights of medical information. Let me put it in general category. All of those folks that we're watching the closest have issues around O2 saturation, which is a concern with the virus. But none of them have situations that I would describe as overly concerned. We're concerned because of the O2 saturation issues. I think that's the best way to put it in general terms, without talking specifically from person to person and getting in a situation where I could potentially violate their privacy rights.
And that includes the one individual that is hospitalized. Do you have O2 concerns as well?
I would say yes.
Okay, thank you.
You're welcome. Is that anybody else for questions, Rachel?
This is the last call. I know we have the CalRec, Vermont Business Magazine, Herald, and WCAX on the line. And if anyone else has any questions, we'll give it 1 minute. Unmute yourself and ask away.
This is Patrick at the Herald, and I'm fine.
Hi, Patrick. How are you?
Yeah. Thank you, Patrick.
Ms. Baker.
Okay, I guess we answered the
Patrick, if
questions.
you have any follow-up questions, you can email them to me and we'll make sure to get you an answer.
Very good. I appreciate it.
Of course.
Okay, folks, I'm going to take that as we've answered the questions that you had. I want to thank you for spending your Bennington Battle Day afternoon with us. And again, when we get more information, we will do another press availability, especially as information develops in Mississippi. And, we're hoping, I do think I mentioned earlier that the last round of testing in Rutland will be done tomorrow. And that will be that will finish off our protocol as a result of those positive tests there. So we will get you updated on that as well. And again, thank you for joining us, and I hope you have a great evening.
Thank you all. Again, the recording will be posted on our YouTube page as soon as possible. And if you have any follow-up questions, please feel free to email me directly. I know you all have my email because that's how you got into this meeting. So have a good one. Thank you so much.